We're here today to talk about handling cats during veterinary visits, but it doesn't start here in the veterinary practice, it starts at home. So what we need to do as veterinarians is to teach clients how to get the cat into the carrier at home, how to acclimate the cat to that carrier. And then after that, getting the cat into the veterinary practice, into the waiting area, and even better, getting the cat directly into the examination room. Handling cats is critical to getting cats to be less fearful, having clients be calmer, and making sure that you and your team are not injured. However, the real issue starts at home with the cat carrier, where cats are terrified of going into that carrier. So acclimate the cat to the carrier and get the cats to come in much more calmly and bring them into the waiting area. And if possible, even bring them directly into the examination room. To best handle the cat, we need to understand the cat and who they are. Cats are predators, but not like dogs, who are pack animals. Cats are solitary predators that need to protect themselves to make sure that they're safe at all times. So they want a sense of control. And what we can do is we can allow them to make the decision so that they can choose whether to come out of the carrier on their own or not. Hiding is an important coping strategy for the cat. So it's important to allow them to stay in the bottom half of the carrier or to have a towel to cover them so that they can feel hidden. Cats don't like anyone staring or looming over them, so it's important to come from behind or the side and to do so slowly so that they feel more secure. If the cat is a lap cat at home, it works well to allow the cat to sit in your lap. There are a lot of benefits. One is you can face the cat away from you. You're not looming over it, and you can have the cat lean against your arm, and so you've got the cat held this way. Also, it's against your body, so it can't go backwards, and then you can start massaging the head, which is really important where their pheromones are. It really helps them to feel more secure and comfortable. The other thing is you can be sitting with the client and being at the same level as the client and the cat so that you are communicating as a team with the cat. The other things that are really helpful for this are that you can do the exam with one hand and you don't need a holder, which makes it much less stressful for the cat. And you can complete the exam pretty much so with one hand, looking at the eyes, ears, teeth, the rest of the body going through with the entire exam. If the cat is fearful, allow the cat to stay under the towel and move the towel gently so that you can examine the different parts. Again, the cat does not like to be loomed over or stared at. Standing to the back or the side will make all the difference. The exam does not need to be in order. Examine the areas that are not painful first. Many cats, especially senior cats, have arthritis in the legs or back. Wait on these areas until after you've given the analgesia, done the rest of the exam, and then now examine those areas. If the cat is food motivated, use treats or canned food to distract them. And we all know kittens are easily distracted by toys. You can even swaddle the cat in a towel or a blanket to help make them feel more secure. If the cat chooses to be on the floor, get down on the floor with them. It'll make the exam so much easier, both for you and the cat. Always be flexible when examining a cat. Some prefer to sit, some prefer to stand. Allow them to do that. Wherever you examine the cat, remember to move slowly, talk softly, and use minimal restraint. If the cat gets restless, give it a break, even if it's only for a very short time. Cats don't like tight restraint, so instead of stretching out the cat and holding onto their feet tightly, just put an arm in front of their body or loosely hold onto their legs. Scruffing and copnosis do not allow the cat a sense of control, and the cat can become fearful and even aggressive. Instead, stick to the head and neck. This is where the facial pheromones are, and so the cat is marking you with the pheromones, as well as the area where cats will groom each other, so it is familiar to the cat. Remember, fear and pain are the two most common causes of feline aggression in the veterinary hospital. Analgesia should be used for cats that are painful or potentially painful. Sedation or anesthesia may be needed for the cat that's fearfully aggressive. Do not rush when examining a cat. Move slowly and consistently, and allow the cat to be where it wants to be, even if it's in the bottom half of the carrier. Adapt an individual plan for each cat. Some cats prefer to hide under a towel or stay in the bottom half of the carrier. Others want to be next to their person on the bench, or in their lap, or in your lap. Let the cat choose. That way you can get your exam done and the cat is more comfortable. Focus on specific handling techniques. If the cat is fearful or anxious, save the high anxiety activities for the end of the exam. Weigh the cat and note any changes in the weight, body condition, or muscle score. Using these techniques can make it much easier on everyone involved and makes it much more likely that that client will be back in your practice soon.